Thanks for being with us. We have a special guest today. We have been working continuously for the last 20 years in the field of cerebral palsy. Dr. Jitendra Jain, sir, chairman of Trishla Foundation and pediatric orthopedic surgeon. He did his MS orthopedic from PGI Chandigarh. He had a great love for children. He started his practice as pediatric orthopedic surgeon in 2002. Since first day, he started working for the children with cerebral palsy. For guiding to those children, in 2005, Savedna Trust was created. But this was not enough to take the campaign very far. So in 2014, he started Trishla Foundation. Today, this organization has connected to the CP children from worldwide. Today, we are going to talk to him. Hello, sir. The experience of guiding more than 50,000 cerebral palsy children and their families. How did all this started?
Good day for all the viewers who is watching our YouTube channel. I can say that I started my own practice in 2002 as a pediatric orthopedic surgeon. Initially, when we see these children with cerebral palsy in our OPDs, we used to advise that go to physiotherapy, do nursing care of these children, do as much as possible, but these children will not be independent, they will not be useful for the life. And life, we don't know how much they can go. But we started thinking that something has to be done for these children, and worldwide lots of awareness program was started in 2010, I think so. Lots of activity was started. We developed Samvedana in 2005 and 2014, Trishla Foundation. Initially, most of the children with cerebral palsy come to us in very later age groups, just like more than 10 years, 12 years, 13 years, 14 years. And only those children reach to us who are able to stand, sit, walk with some support. But most of the children who doesn't stand, doesn't walk, no parents is able to take them to our places because it is very difficult to take all those bedridden children and adolescents to a different places for treatments. But in last 20 years, we have made lots of awareness by conducting nearly 170 camps all over India. And after the corona, our social platform was very strong, and by the YouTube, Facebook and other methods, we have reached to the nearly every corner of the India and many other countries. Now the children came to us within 3 to 6 months. It is because of only awareness. Parents are now much more aware when they feel that these children is not able to sit, no activity like the normal children. They start searching on the Google and YouTube, then we'll get the different name of these centers in which Trishla Foundation is one of the center, and they ultimately come to us. But what we have seen, this treatment protocol, what we were given at that time, that is only palliative and sometime corrective surgeries. But nowadays, we start giving training to the parents so that they can do therapy and activity to children. There is total different scenario happen in last 20 years. That is happen only because of lots of awareness and presence of cerebral palsy related material on the different social platform.
Sir, as you say that nowadays age group of 3 to 4 month children are coming for the treatment. So in such a small age group of children, is assessment is possible, and if it is possible, then you recommend them to stay here for 3 to 4 months or not?
Just see it, that 3-4 months earlier when we used to sit in our hospitals, clinics, then used to say that no, we cannot confirm these children suffer from cerebral palsy before the age of 2 years. But now we have seen that if child have the history of premature birth, low birth weight babies, asphyxia, the sign and symptom of the this oxygen deprivation to the brain, and not performing the as normal children, just like social smiles is not there, uh, vision is not proper, sucking reflex is very very poor, no neck holding, then we can confirm that this child will have the cerebral palsy, and confirmation usually made by the MRI of the brain, but usually we don't know. Usually we make the probable diagnosis of cerebral palsy at this age by the clinical examination and history, and by that child is so early age and problem is in the brain, so they need only sensory stimulation, different positioning exercises and how to deal with them. this these parents can be trained enough so that they can do therapy and sensory stimulation at home. So most of the time we never ask any children before the age of 18 month to stay at our center. We provide training to them 1 or 2 days, or online training facilities also available. By that they can get all this required sensory stimulation and correct posture methods so that they can do at home. And most of the time these early age children require different play activity by the toys, stimulation by the lights, and different hand activity. You have to talk lots with these children with the eye to eye contact, so that eye contact will be better. So initially our aim is to have good eye contact, good neck control, sitting balance, hand activity. Then afterward, when they are started sitting and crawling, creeping, then we can ask to stay here and get advanced training in other methods of therapy.
Before going to the other questions, I would like to tell you that if you have any query in your mind, then you can contact us on the number 9455001645. Sir, I want to ask you another question which is in my mind, that if we talk about older and younger age children, in which age group you see more improvement?
Uh, when we child came in the older age group, that means adolescent and adult, they will come in two scenarios. One scenario is they are not able to sit, not able to do any activities. At that time we can't do anything in these children. Other scenario, they are walking, they are sitting, they are doing activities, but they have lots of deformity in the limbs, so they need the surgery and followed by the therapy. But whatever we are giving, that is only corrective surgeries and training to the advanced methods of the activity, but their capability cannot be changed. If the child is coming at very very early age, then we can provide lots of sensory stimulation, therapy, training into activities of daily lives. And what we have seen, that earlier most of the children need botulinum toxin, surgery, braces, but now children are coming at very very early age. They require only therapy, trainings, schooling, bracing, minimal surgery and minimal botulinum toxin is required. As we know that surgery is required only up to the 7 to 8 year age groups, and with advanced method of therapeutic modalities, now number of surgery has come down drastically. So that is the benefit of early intervention. Early intervention give always very very good result, much better than when the children came in the older age group. Even in older age groups, hip is dislocated, then hip is destroyed, most of the time hip is destroyed. If it is recognized at very very early age, we can prevent it from going into dislocation. So that is the benefit of the early recognition and early identification.
Most of the parents are coming and saying that despite of doing therapy continuously at different centers across the country for the years, but they are not getting benefit from them. And after coming here, they see a great result in their child. What are the reason and how therapy is Trishla is different from others?
Training at Trishla is not so different from the international scenario what we are seeing all over the developed countries. But problem in India and most of the developing country is that earlier we have lots of children and adults with polio and lots of paralysis cases, where we used to do general exercises including stretching, joint mobilization, and it is very very older concept of physiotherapy in the cerebral palsy also. But as you know that cerebral palsy is not a one type of the cerebral palsy. They can have different type of the tone pattern, different type of the presentation. So every type of cerebral palsy needs different kind of the therapeutic modalities. As most common is the spastic and dyskinetic. Dyskinetic in that athetoid and dystonic cerebral palsy. In spastic, as sometimes we need the stretching, but that should be very very controlled method. Joint mobilization never needed in any kind of cerebral palsy, but in dyskinetic and dystonic cerebral palsy, even stretching exercise is not needed. What they need? They need relaxation, they need positioning, they need proper posture control. Their pelvic control is very very weak, core muscle is very very weak, all the muscle in the body, most of the anti-gravity muscle is weak. So they require strengthening, power generating exercise is required. So the therapeutic modalities what we see nowadays is totally different from the older era. And but that older method of therapy, that is a traditional method of therapy, is being used in different part of the country. That is that's a bad effect on the cerebral palsy children. So at our places, we are having seminars, CMEs, research, lots of literature reviews, and what we are following the international guideline. In that guideline, we are following the 5A factor. 5A means family, friends, fun, and they have to have a future. We have to decide. So in that category, we have to give much more training to the activities of daily life. So our protocol, it depends upon the type of the cerebral palsy. Whatever type of the cerebral palsy, in every children of cerebral palsy, we do training in activities of daily life. Most of the time we depend upon the strengthening exercises so that the power of the muscle can be increased. And in most of the children, core muscle is very very weak. To be focus on the core muscle strengthening, pelvic control exercises. And when we see that child is having the dystonia, dyskinesia, we advise parent to have the powder massage, no oil massage, no stretching exercises, no rapid movement exercises at the joint. So with this method of exercise and different kind of the yoga asana we are using in different children with cerebral palsy also, they are giving excellent response. At what we seeing within a 2-3 months, 4 months, parents are being trained enough so that they can do therapy at home. And even children who is not able to do any activities before 3 months, before coming to here, not able to sit, stand, walk, lots of activity, but still they need continuation of therapy at home. They have to do for years together, and all those parents are being followed by the online training and online consultation. So that totally different scenario at Trishla Foundation from the other places.
So my next question is based on your whatever you tell us that right now, this concept of online session, how came into your mind?
The online session was started during this time of the corona, because at the time of corona all our center was closed, and that was closed for 7 to 8 months. Lots of children and parents who are staying very very far away from this place, not able to contact us, not able to come here, and what were previous our patient, they were also not able to visit here. So that we started online training session. In the online training, we focus mostly on the problem of the child, what are the problem child is facing, and that training is totally home based dependent. When whatever material parents have at home, the therapist will give training to according to that, so that they don't require any special instruments. They can understand very very beautifully. All this training are being done on the Zoom, and the parents can make record of that training on the laptop or mobile, so that they can repeat many times in a day continuously for the long duration. What we have seen in last 3 years, that more than 3,000 families who have received the online training product, they are satisfied. We have seen that lots of improvement in the children, and what were myths and older concept of therapy was they have changed dramatically, and now they are coming after getting sufficient improvement. They are staying here 1 or 2 months, and now children are showing very very excellent response in that.
Sir, but the difference between staying here on the center and doing therapy and at therapy doing we are doing at home is far different. So the in online sessions we can see a result in our child or not.
देखिए parents are the best therapist for their own children because they have only one children who is affected with cerebral palsy, and cerebral palsy very vast subjects. The therapist specialist has to read for years so that they can understand about the cerebral palsy. If parents is sufficient educated, they can be given sufficient training, and because the children are going to remain with the parents for 24 hours in a day, and they require therapy, training, positioning, posture control, all those things for years together. They cannot stay at different places, so parents has to learn all those exercises. If the children are coming to the center, they will come only for 30 minutes, 40 minutes, 45 minutes, 1 hour maximum. As some children have very troublesome problem, parents cannot do, they have to stay at our center. Children who is the much older age groups where parents cannot tackle, some new problem arise, then they should come to our center. Otherwise they can do therapy at home, they can learn, they can understand, because our senior most therapists, and properly we have made this different protocol. In that protocol they are giving training to the parents so that parents can easily understand, can easily learn, and they can do easily and without any side effect. We don't have seen any complication in that online training program.
So whenever any parent come to our center, they have a only wish that their child start walking independently. So it is possible for every child to walk independent.
What I will say you that, देखिए independency in issues of disability is totally different from the general population. Every person is not complete. I am wearing my glasses, other person have a diabetes, someone have a heart disease, hypertension, so no one is complete. Independency means the person are able to do all these activities of daily life by their own, or they require help from someone else. One thing. Second thing, how much they are happy. They are able to communicate their wishes, their problem with the person in the families or society. How they are understanding the different issues in the environment and situations. This is the independency. Independency means we have to give training to the parents or children so that they can do all those activities of daily life like eating, drinking, going to the toilet, dressing, undressing, wearing the socks, shoes, going to school, learning, having the professional job. All this is make the children independence. The walking is not independence. In developed countries, most of the children who is not able to walk, they are using the wheelchair. They are much more happy when other children are able to walk. And one thing I also clear, in cerebral palsy, if you are giving the highest quality of treatment, then 60% children can have the independent without any support, they can walk. 20% children will require stick and elbow crutches, 10% will require the walker rollator, and 10% still require nursing care. So the children who is completely disabled on the bed, they require the good health, nursing care, and they can communicate their problem with the parents. That is the basic aim that children. So every children cannot be same, and it is the fundamental in the gross motor functional classification GMCS 1 to 5. This is the GMCS classification that shows that every child have the fixed neurological development at the time of birth. But we can determine at the age of 5 to 6 years. 1 to 3 means they are able to walk. 4, 5 means they cannot walk. They need support.
Sir, nowadays we are saying that tightness is the most common problem in cerebral palsy children. We are saying if we compare out of 10 children, we are seeing 5 to 6 children are tight are suffering from tightness in their body. So this tightness, for the treatment of this tightness, some kind of special training therapy is being required, or some other type of treatment is given to that children.
The cerebral palsy, nearly 60% cerebral palsy children will be the spastic, 15 to 20% will be the dyskinetic, and others will be the ataxic, hypotonic, other variety will be there. And nowadays, what we are seeing that lots of children, because of awareness, they are going to the physiotherapy center, they are getting different kind of the general exercises. By that, their pattern is becoming changing day by day. They are getting lots of deformity in the limbs because of abnormal exercises. Even their dyskinetic pattern is increasing. What we are seeing today's nowadays era with our protocol of powder massage, relaxation exercises, different yogas and training and activities of daily life, and different kind of the core muscle strengthening and activities, and lots of eye to eye contact exercises, activities, their tone is becoming normal. Earlier, we used to give botulinum toxin in many children, and you know what? At some center, lots of doctors are advising. There is baclofen tablet, pycetin, lots of antispastic medicine also. But we require very less medicine for all those tightness in spastic measures. They are being relaxed only by the powder massage, different kind of therapy method. In dystonic cerebral palsy, dyskinetic, we need some medicine that should be taken under the doctor guidance. But role of botulinum toxin is becoming very less nowadays.
So my next question is that only the use of botulinum toxin nowadays is very decreased nowadays. Why? Is there is any type of side effect is coming out?
When we start our treatment protocol in 2002 for the cerebral palsy children, then first time the botulinum toxin came in that time only 2000 only. We were very happy that some miracle is came. Now cerebral palsy children will have ability to walk. We started using. Most of the companies who are supplying the botulinum toxin, they advise that they have to give in 3 to 4 month interval repeatedly. But from earlier days, we were also worried about the two aspects. Side effect, we don't know. Side effect is usually clear 10, 15, 20 years. And other thing is financial issues, because that was costly medicine. So we used to give once or twice injection in spastic cerebral palsy, rarely in the dystonic cerebral palsy. And third time we never given, only the few 4 or 5 children in 2000 children we have given. But most of the places, the children were given repeatedly 3, 4, 6 times. Only 2 years back, we have received one article from the international scenario that shown in the rabbit there was muscle fibrosis and muscle changes into fat. It is proven now. And these results came after repeated injection of the botulinum toxin. And we are not using botulinum toxin repeatedly since early days. And you cannot believe, earlier we used to give botulinum toxin is more than 70, 80 children per year. Now with good therapy, good bracing, good protocol, we doesn't require botulinum toxin more than 10, 12 patients in a year. Beside that, the number of children coming to our center is increased many folds. Nowadays, per year, I think so more than 2000 children are coming here. But rarely we require botulinum toxin. In the place of botulinum toxin, we give plaster, we give different type of the therapy. In some children, where still really it is very tight, we cannot perform the therapy. The botulinum toxin has, plaster have no role. Then we used to give botulinum toxin.
Sir, what is the role of plaster in cerebral palsy children, and why you give preference to the plaster?
Plaster was the very old traditional method of treatment in the cerebral palsy. It was being used before botulinum toxin came in the scenario. But it was disregarded because every year the children was given plaster. We call them birthday syndrome. Every birthday the wish was give the plaster and they are admitted in hospital. But as plaster is very good role in the cerebral palsy, some children where muscle is tight, very very early age, where we are not going to perform the surgery, we are not going to use botulinum toxin, and even with botulinum toxin we used to give plaster. The plaster application for 1 to 2 week in spastic cerebral palsy in 2 to 6 year age groups, very very useful, very cheapest method also, and that gives some relaxation of the muscle, so that therapist can perform therapy beautifully and child can wear that brace AFO nicely without any pain. So that was the beauty of the plaster. We are utilizing the plaster application in few children when muscle are tight, but the child is age is not sufficient, so that we can go for the surgery.
Sir, do children with cerebral palsy also need surgery?
Yes, the when surgery is needed and why surgery is needed in cerebral palsy. Surgery means neurosurgery, surgery means orthopedic surgery. Neurosurgery very rarely needed because we cannot do anything on the brain. Sometimes some person they are doing their spine surgery, they are doing on the nerves, selective neurotomy also going, SDR surgery, selective dorsal rhizoptomy given. In orthopedics part, the orthopedic surgery is indicated when bone is deformed, joint is deformed, muscle are short, foot is deformed, muscle are weak in the hand, so that tendon transfer can be done. But usually we defer the surgery till the age of 7 to 8 years. Early surgery is required only one case where hip joint is not normal, hip joint is subluxated, adductor contracture is there. But even in orthopedic surgery, I will tell the story that in 2005 when I started Sambindana Trust, I met Dr. Takase Masuwa from the Japan. They started giving the one concept of OSSCS, orthopedic selective spasticity control surgery. In that concept, he tell us there is a long muscle, that is multi-articular and biarticular muscle. The muscle that crosses the more than one joint, they are the spastic. He used to lengthen. How he lengthen? Just release of the facial lining of the muscle, so that there will be not a weakness. But they used to do multiple level: foot, knee, hip, upper limb, shoulder, elbow, forearm. But usually we used to examine the child, physical examination only. We never analyze the gait analysis. So that we have done early 5 year, we have done OSS surgeries, many patients. We have not seen any side effect in that children in spite of 10 year, 15 year follow up. But when the gait lab came in scenario, we started using the just video analysis, just by taking the video from the side, front and back. What nowadays fundamental is coming, that we are going to manage the functional issue, not the structural problem, the cerebral palsy. So that our scenario has changed. One thing is also very should be clear, this muscle in the cerebral palsy is always weak. When we are doing surgeries on the muscle, they are going to be much more weaker. Earlier we used to give just release of the fascia, they were not weaker. Then why to do surgeries? We were thinking. Then came the concept of the lever arm restoration. Lever arm problem is the bone is deformed, torsion abnormality is there, joint is not normal. In that case, muscle is not able to perform their function up to their highest level, because they are not able to perform their action because their attachment was not proper. So we started doing surgery more on the bone, less on the muscle. That is a new concept, and we used to analyze physical assessment first, then have to have a gait analysis. Then whenever child goes to the anesthesia, again we examine. Then we compare and see what the problem, what we are seeing the gait analysis, and what are the problem with when we examine in the under anesthesia. Then we decide the which level, what type of the surgery child is needed. So in latest method of the orthopedic surgery, less muscle surgery. When we wanted to do some muscle surgery, only facial release, transfer of the tendons, and mostly we correct the all the deformities by the bony surgery. Bone when heal, they become normal, though muscle weakness will be occurring. So after surgery, intensive therapy will be given to the child, strength training, so that power they can get back, they will start walking and they have very, very good improvements.
Sir, nowadays hip location is also normal in CP children. In that case, what kind of treatment is required in children?
In cerebral palsy, hip dislocation, that means hip joint, femoral ball, most of that come out. But it depends upon the what GMFC's label the child have. GMFC's label means child is walker or non-walker. One means completely independent, two means independent inside the home, but they need support outside. Three means they need support of the walker, elbow crutches, stick. Four means they always require support of someone else. Five means on the bed. When you analyze by the different research paper what we have seen in the international scenario, then this hip dislocation increases as their disability increases. In GMSS 5, that means that child is bedridden, is not able to sit, not able to stand. In that cases, more than 90% children can have the hip dislocation. GMFCS 4, when they require complete support of someone else, the chances of hip dislocation 70%. In GMFCS 3, 40 to 50%. 2 means 15 to 20%. So, hip dislocation can be preventable. If not prevented, once hip dislocated, slowly with the age, when the femoral ball will have the rub against the established margin, they will damage. Once damaged, child will have the pain. They cannot sit. They will cry. We cannot give lots of medicine to these children because this painkiller will have the very, very harmful. So nowadays screening of hip is very, very important. Nowadays, whenever child came at the age of 2 years, more than 2 years, first we will have the X-ray of the hip. By that we can see the migration index, the percentage of the femoral head outside the sternum. If this more than 30 to 40%, then we have to see what are the causes. Most of the time adductor muscle is tight, that means scissoring, crossing of the leg is there. So we do adductor tenotomies, just release a minor surgery, adductor tenotomy, and we ask the parents to keep the limb outward in wider parts. And once subluxation increase, we can put screws on the femoral head, but once it is dislocated, hip joint need recustom, that is a bigger surgery, that need osteotomy and bone corrective surgery of the proximal femur, as well as the cup, that means established surgery is required. So that we can prevent it, we have to screen it, we have to check it every 6 months when the child is completely bedridden, is not able to stand and walk, and every 1 year child which is walking with the support. So by the good assessment screening, I can prevent the hip dislocation. That is a very, very big complication for these children with cerebral palsy.
Sir, in our yesterday session, many families is asking, continuously asking one question, that how can we ourselves assist or we can make assessment of our children that he is suffering from any type of disorder or not? How can we know that our child having CP or not?
Because CP is present or not depend upon different symptom. Child is performing at their age group children or not. If child is 6 months, no neck holding, if there is high risk history is also there, no history of the cry, asphyxia, social smile was not there, neck holding is not proper, sitting is not proper, then the chances is that child is suffering with the cerebral palsy. If still child is not able to sit at the age of 8 months, not able to stand at the age of 18 months, this is most probable that this child can be suffering from the cerebral palsy. And most of the confirmation can be made by the pediatrician or pediatric orthopedic surgeon. Sometime we need MRI to exclude the other causes of the disability.
So whenever a child is born in a family, people think that the one who take forward our claim has come. Their hope are associated with that child. But when the same child is affected by a serious problem like cerebral palsy, then how should that family member compromise between their hope and reality?
See that hope and reality, two things is there. Hope, every families, every parents want that child, when they grow, they should grow at a normal phase. They have to take some responsibility of the family. They can take responsibility of ourselves, whole family. But reality that cerebral palsy is lifetime problem. It's not a one time problems. Child need to be managed whole life. This is not going to disappear. And whenever the child suffering with the cerebral palsy, then the proper assessment is primary importance. What kind of disability child have? And every child is very very important part of the families. The parents should understand their psyche, their position, what are the kind of cerebral palsy. And then more than 60 to 70% children have the normal IQ, so they understand the psyche of the parents. Most of the time parents start thinking in negative patterns. They are not able to do any activities, how they will survive, how they can do. Our responsibility to give good health, to train them to the highest possible level, so that they can manage their activities of daily life. They can learn, they can understand, they can go to school, so that they can get professional degree, they can have the job. So from start, every parents has to do, first thing is proper assessment. They should know everything about their own children with cerebral palsy, how they are going to manage, and what are the kind of disability. All these children should not be pressurized, so that no, you have to walk independently, this support is not required. If you are pressurizing them, they will be psychologically depressed. So we have to decide between the reality and fact. Reality, this child is suffering with cerebral palsy. Different kind of the cerebral palsy children will have different grade of disability. So that if your children are coming in the grade of GMCS 3, okay, he will walk with elbow crutches, okay, no problem. We have to give training to the walking in the elbow crutches or stick. But schooling is also important along with that. If you are focusing only on the walking capability, you are not giving training to the hand activity, so that they can write, they can use the laptop, mobile, so that they cannot be independent. So it is very very important for the every parents to not pressurize their children. They should know each and everything about cerebral palsy. They should give happy and good life to these children, and future planning of every children should be made. Because we know that most of the private agencies and government setup used to give 4 to 5% reservation. If make their own child to have the professional active person, they can join the any companies, they can have a good professional life, they can have a family life, they can marry, they can have a child. But only thing, we should be very very positive about your own children.
Sir, we have a question from our viewer whose name is Asutosh Kumar Mishra. He has a child of 1.5 year who's is unable to hold his neck. He has a not neck holding. He want to ask that is his child is a CP child or something. He is a delayed milestone.
Okay, 1.5 year age, neck holding is not there. That means it is a cerebral palsy. Delayed milestone, I can say that if child is 1.5 year, is able to sit, stand, but not able to walk, then we can label as a delayed milestone. Neck holding came usually at the age of 2 to 3 months. It's not 1.5 year age. That is cerebral palsy. If cerebral palsy is not there, no history of the premature birth, no low birth weight, no history of asphyxia, then genetic problem can be there. So that you should go for the pediatrician or pediatric orthopedic surgeon, have the detailed assessment. If MRI is not done, they can go for the MRI also. If MRI is normal, then we need the genetic analysis.
Sir, at last, some suggestion you want to give to our viewers?
Only one suggestion I want to give to our parents of children with cerebral palsy, that your child is affected with cerebral palsy, and cerebral palsy is going to be lifetime. So you should know each and everything about your child. should be made aware about their own problem. They should understand. They should go to the school. They should have a professional degree. You should take your own child to the all the social function wherever whichever place you go, because with that all the person, the society will understand the problem of the children. If a child is very very bright, they will start thinking the positively. If they start thinking negatively, you should teach them, tell them that no, is my own child is very bright, we will have to make this child. And all the parents who know everything about cerebral palsy, they should also make aware of the other point of cerebral palsy. So what is the latest mode of therapy and what is the latest kind of treatment in cerebral palsy is there, and they should utilize the social media so that other parents can understand, they can know much better about all those children. With that impact, even the specialist, even the therapist, even the doctor will start thinking in better term, and they will learn all those latest technique which were coming nowadays all over the world, so that no children of the cerebral palsy will left without any treatments.
Thanks for sharing your experience and such an informative thing with us and with our viewers. One thing I want to recall to you all, if you have any query about your child, about any type of treatment, you can contact to the number 9455001645. Thank you.